Good day. The topic of our today's lecture is circulatory insufficiency. Circulatory insufficiency is a pathological condition in which the cardiovascular system fails to supply the necessary amount of blood to the organs and tissue for their adequate function. Approximately, we distinguished heart failure and vessels or vascular insufficiency. When we are talking about heart failure, problem appears due to progressive decreased contractive heart ability. Vascular insufficiency, when the circulatory vessels cannot adequately to hold blood circulation. Let's talk separately on both these problems. And first of all, I want to remember scheme of the blood circulation. We distinguish three types of blood circulation. Greater circulation, which is started from left ventricle and control blood supply all inner organs and finish into the right atrium. Lesser circulation, which start from right ventricle and go through the lung and control gas changing. Finish into the left atrium. And coronary circulation, which appear during diastolic period and control blood supply of the heart, main organs of our organism. You must understand, when we will talk with you about heart failure, we will distinguish it on two types, left and right ventricular failure. I'll again watch that you see on this picture left ventricular failure. Left ventricle unable to eject definite volume of blood due to weak contraction. Right ventricle contract usually. What will be? Blood which ejected into the lesser circulation must come back into the left heart chamber. But it's impossible because volume of left ventricle which was ejected lesser than right. Some blood delay in lesser circulation. Left ventricular failure manifested with congestion of blood in lesser circulation, which cannot come back due to non-adequate contraction of left ventricle. Same problem with right ventricle. If the contractive ability of the right ventricle diminish, blood from greater circulation cannot come back completely. We are talking about congestion of blood in greater circulation. And first of all, blood will be hauled into the lower part of the body because due to physical gravity law, it's easy come back from upper part along vena cava superior. If it's clear for you, let's talk about mechanism formation of the heart failure. Heart failure, decreased contractive ability of the heart, appears first of all due to damage of the myocardium and its metabolism disturbance. Other problem, it is overloading or overstrain of the myocardium. When the primary health heart unable eject adequate blood volume because it's overload or overstrain. Let's see pathology in which appears this problem. We are talking about damage of the myocardium and its metabolism disturbance. First of all, there are infectious, inflammatory, or toxic affection of the heart. Other word, we are talking about myocarditis of various etiology. It may be affection by bacterial, virus, or any toxic agent. We said about definite activity of the heart. It is possible due to adequate blood supply. Insufficiency of blood supply to the myocardium accompanied with dystrophic process in them. We are talking about ischemic heart diseases when the blood supply restricted due to narrowing of coronary vessels because formation atherosclerotic plaques, or anemia, no problem with vessels, problem in amount of red blood cells, which are main transport system of oxygen. And next problem, metabolic disorders, because adequate heart contraction tightly connected with some microelements, vitamins, which are coenzymes which needed to control some metabolic process, and we must remember about some endocrine dysfunction, and first of all we must remember about thyroid gland which regulate activity of the heart. You see damage of the myocardium due to some pathological process can decrease contractive ability of the heart and manifest it with heart failure. Diseases which appear due to some metabolic disorders are named as cardiomyopathy. Cardiomyopathy. We said about overloading and overstrain of the myocardium. When the primary health heart unable adequately to eject some blood volume. First of all, due to hypertension in greater, which is provoked factors of left ventricular failure, or lesser right ventricular failure. Other problem, heart defect, which characterized with narrowing of some orifice, overstrain, or insufficiency of heart valves, overloading due to pathological regurgitation of blood. If we are talking about overloading, it may be with involvement left ventricle or right ventricle in pathological process, or maybe combined when both ventricles involved in pathological process. Overloading divided on two types depending of time of the heart activity. Systolic overloading appears when the heart cannot eject some blood due to obstruction outside of the heart. If we are talking about left ventricular systolic overloading, we remember about narrowing of the aortic orifice, aortic stenosis, or increased pressure in greater circulation, arterial hypertension. Right ventricular systolic overloading appears due to pulmonary trunk stenosis or increased pressure in left circulation. Diastolic overloading is characterized with problem which overfilled myocardium during diastolic period. Left ventricular diastolic overloading appears due to aortic or mitral regurgitation due to insufficiency of the aortic or mitral valve when the left ventricle overfilled with blood and its contractive ability decreased. Right ventricular diastolic overloading appears due to tricuspid or pulmonary trunk regurgitation due to tricuspid or pulmonary valve insufficiency. You understand? Some long-standing problem obligatory involved other part of the heart in pathological process. Primary left ventricular problem finish with both left and right, and process can start from right ventricle, but after some time it also may be combined. Both ventricles involved in pathological process in combined heart defect. It may be problem with right and left ventricle valve or orifice. It is more characteristic for congenital heart diseases which appear in younger period, and adhesive pericarditis which restrict activity of both heart chambers. Classification of the heart failure may be by cause. We distinguish acute and chronic by dysfunction, about which we said 1 minute ago, systolic, diastolic or mixed, and by primary affection, left, right or total heart failure. And today we'll stop on the left and right ventricular failure. It's acute or chronic cause. Because on exam, these questions will be given separately. Acute left ventricular heart failure. You must understand, we are talking about acute because it appears suddenly. Left ventricle suddenly during short time progressively loses contractive ability. It is possible for the patient with myocardial infarction, diffuse myocardial infarction with deep and wide source of necrosis. It is characteristic for the patient with essential hypertension hypertension, period of hypertonic crisis, when the blood pressure suddenly and significantly increases and heart cannot immediately adequately respond to this problem. You must understand, we are talking about acute situation when our organism cannot adequately respond to any acute situation. It is aortic heart defect and first of all progressive aortic stenosis when the aortic orifice such significantly narrowed that heart unable adequately eject definite blood volume. And diffuse myocarditis, again, process spreads on whole myocardium, short time process, which doesn't give time for adequate compensatory response. Acute left ventricular heart failure appears suddenly during short time because some pathological situation not correlated with compensatory response of the pathogenic mechanism. We see contractive capacity of the left ventricle progressively decreases when the activity of right ventricle is satisfactory. Remember our first picture. No problem if the ejected blood same from right and left ventricle approximately. That ejected blood can adequately come back. What will be? Blood delayed in lethal circulation. We remember every minute heart contracted from 60 to 80 times. Every contraction, some blood delayed in lethal circulation. What will be? Pressure in the vessels of lethal circulation increases because they overfilled with blood. As a result, will be increased permeability of capillary and blood easy absorbed into the alveoli. First of all, it is called into the intra-alveolar part. We are talking about intestinal edema, which clinically manifested with cardiac asthma, and then it actively moves into the alveoli. We are talking about alveolar edema, which clinically manifested with lung edema. Gas exchange upset because adequate gas changing is possible due to elastic empty alveoli and adequate blood circulation. Blood delayed, alveoli filled with blood, enable adequate gas changing. Let's see on clinical manifestation. I said you when the first of all pulmonary vessels overfilled with blood, blood absorbed into the intra-alveolar space. Activity of alveoli restricted, patient cannot adequately inhale. We are talking about attacks of cardiac asthma attack because sudden process. Then blood Going to the alveoli, we are talking about lung edema. Clinical picture of the acute left ventricular failure can be divided on two periods: cardiac asthma and lung edema, and doctor has sometimes to help the patient and prevent his death. Attack of cardiac asthma. Patient suddenly feels severe dyspnea, which then transforms to asphyxia. Usually it appears early morning period, 3-4 hours a.m. If activity of alveoli restricted, patient feels some discomfort, maybe dry cough, sometimes maybe expectoration of viscous tenacious sputum. You understand, when any problem appears suddenly, our organism responds with vegetative nerve reactions. Patient covered with cold sweat and feels progressive weakness due to hypoxia. On inspection, we see first poster, you remember orthopnea. We said about this poster, which is characteristic for patients with attack of bronchial asthma, and this posture may be of the patient with cardiac asthma, but you see, patient put his extremities downward to hold blood in greater circulation, which difficulty come back into the right ventricle. As a result, ejected blood volume decreases and blood which delayed in vessels of left circulation also will be decreased. Skin of the patient will be pale but with bluish color, pale due to non-adequate blood flow, cyanotic bluish because hypoxia, and covered with cold sweat. Visible signs of acute left ventricular failure. Patient call you due to severe dyspnea, asphyxia, and progressive weakness. You see first posture, cyanosis, and cold sweat. On auscultation, over the lung will hear rush respiration, maybe some dry rales due to connection of the viscous sputum into the bronchus. On auscultation of the heart, tachycardia as compensatory response on weak contraction. First heart sound weakened, it shows problem with myocardium. Second sound over pulmonary trunk accentuated, it is heard louder than over aorta because increased pressure in lesser circulation. Next stage, lung edema. Suffocation becomes more intensive and cough becomes moist because blood which goes into the alveoli easy go out into the respiratory tract mixed with inhaled air because patient intensified breathing. He doesn't understand pathogenic mechanism because to decrease formation of foamy sputum, he must breathe slowly and not intensively, but patient feels hypoxia. Patient feels suffocation, and he artificially intensified his breathing. Sputum becomes foamy, its volume progressively increases, and all respiratory tract becomes filled with foamy pink sputum because mixture of the absorbed blood with air. You understand, patient will die from asphyxia. Over the lung will have moist trails, which easily helps the doctor differentiate bronchial and cardiac problems. Because in both cases, patient call you to severe dyspnea and asphyxia. You put stethoscope, dry rails, bronchial asthma, one order to helpness. Moist rails, cardiac asthma, are the way of emergency aid. Over the heart gallop rhythm, which show progressive weakness of the heart. Pulse will be accelerated but very, very weak. Objective signs of the lung edema, final stage of the acute left ventricular failure. Acute right ventricular failure appears due to embolism of the pulmonary trunk or its branches. More easy if will be obstructed small pulmonary branches. Clinically, it's manifested with lung infarction. More grave if the thrombus closed pulmonary trunk. You understand? Right ventricle closed. And after some times, blood circulation stop because left ventricle will eject all presented blood which not enters from the left circulation because right ventricle closed. And patient with embolism of the pulmonary trunk can have only negative way. Only it's this problem finish with death of patient because we unable immediately dilute thrombus or remove it from pulmonary trunk. You see, if some branches of the pulmonary vessels obstructed with thrombus, blood go into the surrounding alveoli. We are talking about lung infarction, which may be treated. This patient may live. Thromboembolism of pulmonary trunk finish with immediate death of patient. Complaints of the patient. Again, first of all, it resembles acute left ventricular failure because patient again feels sudden dyspnea, but very fast increases, more intensively than in acute left ventricular failure. And patient feels sharp pain in the heart region, resembles clinic myocardial infarction. You understand? If the right ventricle closed, blood circulation stop, first of all problem with heart because no coronary circulation, no adequate nutrition, heart contracted but no adequate nutrition. If no adequate nutrition, ischemia of the heart, acute ischemia of the heart, which is myocardial infarction. Clinic resembles myocardial infarction, and if we record ECG during this period, we can reveal signs of myocardial infarction, acute ischemia. On examination, again, false posture due to hypoxia, progressive cyanosis and cold sweat at response of vegetative nervous system. I'll pay attention you on cyanosis. In thromboembolism of pulmonary trunk, cyanosis spreads only on upper part of the body. Face, neck and chest becomes dark bluish color. Pulse will be small and frequent as protective response of the heart. Arterial pressure drops because no blood circulation. And I separate problem which shows congestion of blood in greater circulation. Why? I want that you understand, because when you will read this material in some books, you can see that patient with acute right ventricular failure characterized with dilation of the veins, edema on the leg and enlargement of liver. But I want that you understand this process not sharp. For this problem needed some times, and each is characteristic only for embolism of some branches of pulmonary vessels, which manifested with clinic of lung infarction and congestion of blood in greater circulation. In obstruction of pulmonary trunk, no time for this process because we lost patient during some minutes. We see only specific upper part of the body cyanosis, cold sweat, will record very low difficulty determinated arterial blood pressure and very small and frequent pulse. Chronic heart failure develops gradually, and on exam will be questions about complaints and inspection of the patient with chronic heart failure. General complaints of the patient with chronic heart failure includes dyspnea, cough, hemoptysis, which are characteristic for congestion of blood in lesser circulation due to left ventricular failure, palpitation is general symptoms which indicates about protective response of the heart to compensate weak contraction and decreased cardiac stroke. Edema and pain or discomfort in right hypochondrium indicates about congestion of blood in greater circulation due to right ventricular failure. Other words, when your patient with heart problem complains of dyspnea, cough, hemoptysis accompanied with palpitation obligatory, or edema, discomfort in right hypochondrium again accompanied with palpitation which shows involvement of the heart, we must think about heart failure. Because first problem resembles lung pathology. This problem resembles liver problem. But they were never accompanied with palpitation, which indicates about heart problems. You see a significant full inquiry of the patient. On inspection, visible signs of chronic heart failure. First, posture. Patient with heart failure cannot sleep horizontally, and on his bed we'll see instead one small pillow, two or three pillows, because will be slight sitting, then semi-sitting, and completely sitting position to orthopnea in final stage of chronic heart failure. We'll pay attention on color of skin, which due to progressive hypoxia will have bluish color cyanosis, which in heart pathology divided on two types: ventral, when whole body bluish color, which is characteristic for left ventricular failure, congestion of blood in left circulation, and peripheral acrocyanosis, when only peripheral part of body becomes bluish, tip of nose, ears, lobule of ears, lips, or fingers becomes bluish because congestion of blood in greater circulation due to right ventricular failure. We can see difficult breathing of patient. Usually we'll breathe through the nose and our breathing invisible. We can talk, eat together with breathing, and this process not restrict our breathing. Patient with heart failure, in progressive heart failure, becomes breathe through the mouth. As a result, he cannot talk and eat simultaneously with breathing, and patient needed short break to continue his physiological actions. We can reveal specific Corvisat's phase. I'll show you next picture and give its characteristic. We can see swelling or dilation of jugular vein due to congestion of blood in greater circulation. We can see progressive edema, first of all on lower extremity, then entire body. We'll again come back to our initial picture of which characterized blood circulation when I explained you. First of all, blood congested in lower part of the body and will reveal edema on the legs. First of all, only to the evening, and then entire day. Then liquid go into the cavity and we can reveal hydrothorax, hydropericardium, ascites, edema of whole body, anasarca, but we are talking about inspection. Hydropericardium invisible, but we can see protrusion of abdomen due to ascites. We can see asymmetry of the chest due to hydrothorax, and we can see anasarca when the whole body becomes edematous. Let's see on our patient with orthopnea. I again pay your attention. Same name, orthopnea, for bronchial and cardiac asthma. But in bronchial asthma, patient hold upper extremities on any stand to right diaphragm because intensify expiration through the narrow bronchus. Cardiac asthma will restrict combat blood flow. Patient downward upper and lower extremity, sometimes put basin with hot water to dilate peripheral vessels and hold blood into them to restrict combat blood flow and decrease lung edema. You see semi-sitting position of the patient, and you see cyanotic color of the face, opened mouth because patient breathe through the mouth. We see dilated peripheral vessels. Acrocyanosis, peripheral cyanosis, nose, lips, tip of fingers becomes bluish color due to congestion of the blood in greater circulation and discorrelation between carbon dioxide and oxygen into the peripheral vessel. because if the blood slowly goes through the peripheral vessels, oxygen goes into the tissue, carbon dioxide non-adequately comes back in circulatory vessels. Central cyanosis, whole body becomes bluish color due to hypoxia, which appears primary in left circulation. Blood comes back into the left ventricle with low oxygen level. Cardiovascular faith. You see edematous face with open mouth because severe dyspnea, with slight yellowish color, combined bluish yellowish color due to involvement of liver in pathological process. Slightly later we'll say about it because it is final stage of the heart failure, and due to progressive hypoxia we'll see non-adequate face appearance, yes, which indicates about encephalopathy, hypoxia, non-adequate activity of the brain, because brain very sensitive to hypoxia. Cardiovascular faith indicates about final stage of the heart failure. You see dilated peripheral vessels. It's also is characteristic for progressive final stage when the blood cannot come back from upper part of the body, delayed in upper part of the body also. We see edema, and I'll pay your attention when you answer on this question on exam order with which we'll check edema. We'll press skin to the tibia bone, but along inner surface, no muscles and thin subcutaneous fat tissue. After pressure, we see formation of fossa because when we'll push, water go outside, and sometimes we'll see fossa edema. Later, edema may be revealed on any side of the body. We can press any side of the body, hand, extremity. You see specific brown color of the lower extremities due to trophic disorders. And in summer period, you can see on some people's on the street, elderly peoples with specific hyperpigmentation, which shows dystrophic process due to progressive hypoxia, and you see easy formatted edema when we'll remove some cloth. You see enlarged abdomen with protruded navel due to ascites. But it's not liver ascites because no yellowish color of skin, no dilated vein on the abdominal wall. And if ascites accompanied with bluish color, we are talking about its cardiac origin. Heart examination. First of all, tachycardia, which initial stage appears after some physical exercise, later at rest. We can see gallop breath, which indicates about progressive weakness of the heart and its audible vibration during diastolic period. Heart sound weakened. Force sound due to decreased muscular component. Second sound due to decreased heart stroke and as a result decreased blood pressure. Objective signs Each is echocardiographic examination will count cardiac output, which becomes less than 50%. But now, last meeting of the cardiovascular doctors decided that cardiac output is objective but not main signs of heart failure. First of all, we'll pay attention on clinical symptoms. I'll again come back to clinical manifestation of the chronic heart failure, because then we'll talk with you about classification of the chronic heart failure depending on stages. And to easily understand and give characteristic of any stages, you must clearly understand symptoms which indicate about congestion of blood in left circulation. Due to left ventricular failure, blood cannot come back into the affected left ventricle. Or congestion of blood in greater circulation due to right ventricular failure, because blood cannot adequately come back into the right ventricle. Again, left ventricular failure, weak contraction, delayed blood volume increases, normal blood volume from right ventricle cannot come back, it holds above into the pulmonary vessel. Patient complains of palpitation, dyspnea, then will be cough and hemoptysis. We remember mechanism. First of all, blood delayed into the vessel, then absorbed into the alveoli. Right ventricular failure, non-adequate contraction of right ventricle and normal blood volume from left ventricle cannot adequately come back. It's delayed in greater circulation. Patient again feels palpitation because it's common sign. It's compensatory response of the heart on weak contraction. Specific edema and heaviness, then pain in the right hypochondria. Later may be dyspnea, but it's not such significant. Dyspnea due to non-adequate correlation of the oxygen and carbon dioxide into the greater circulation. I said you, if the blood slowly go through the tissue, they take oxygen as possible more and come back carbon dioxide. Normal correlation disturbed. And our respiratory center immediately responds on this discorrelation because increased carbon dioxide will be dyspnea, but it's later finally. If left ventricular failure start from dyspnea, right ventricular finish with dyspnea. Classification of the chronic heart failure depending of time on definite stages. And I want that you remember, last lectures we said with you about renal failure and respiratory failure. And I paid your attention, chronic failure for any organs, approximately divided on 3 stages. First, initial stage, invisible, compensated, which may be revealed only with special examination. Second stage, subcompensated, visible. Organism cannot decide itself problem independently. And for heart, we distinguish 2 types of second stage, A and B. Why I paid your attention on blood circulation? We are talking about second A stage when in pathological process involved only one circulation, only lesser or only greater. We are talking about B when both circulation involved in pathological process. And you understand, clinical picture will be more intensive in second B stage. And third stage, which is called as decompensated, because in pathological process involved other organs. Same principles for any failure. Initial compensated first stage, moderate subcompensated second stage, if subcompensated it's visible, and final decompensated third stage, because in pathological process, in our case, instead the heart will be involved other organs. We can differentiate any stage depending clinical symptoms and ultrasound result. First of all, we'll pay attention on cardiac output. Principles diagnosis. Now let's diagnose any stage. We'll remember complaints and visible signs, because on exam we'll obligatory ask you, explain clinical picture for second A, for first, for third stage. First stage, initial, invisible. Patient feels discomfort only after physical exercise. He feels heart contraction, palpitation, and some dyspnea. Fourth stage resembles physiological problem after intensive physical exercise. No, I think sometimes you feel palpitation and dyspnea more intensive and deep breathing after physical training. But if it's physiological, it disappears during short time and not needed your long attention. If it becomes pathological, it's needed long time. It's not come back to normal after 5-7 minutes. And patient paid attention. If we paid attention on any process, which indicates about pathology. First stage, problem only after physical exercise. At rest and moderate physical activity, patient subjectively has. Second stage, subcompensated becomes visible. And I'll again remember you, it divided on two groups. Second A and second B. Second A stage, congestion of blood, only one circulation. No, for example, lesser circulation. Patient feels palpitation and dyspnea after moderate activity. For example, he cannot go for third floor without rest. After second or after fourth floor, sometimes he must stop short time because feels palpitation and dyspnea. After intensive physical exercise, maybe cough, because more intensive congestion of blood in lesser circulation. On inspection, we can see fourth posture. Patient comfortably to sleep on two pillows or one big pillows. Second A, due to congestion of lesser circulation because left ventricular failure. Second A, congestion in Greater circulation, congestion in greater circulation. Patient can feel edema on the lower extremities only, which appears in evening and sometimes disappears in morning independently. Patient can feel some discomfort in right hypochondrium, especially after physical exercise. On inspection, we can see edema on the lower extremity. If the patient will examine to the evening, in morning patient subjectively healthy. Second stage, only one circulation, only lesser or only greater. Second B, both circulation involved pathological process. Patient complains of all problem, and this problem appears at rest or in insignificant physical exercise. For example, patient gets up, go to wash mouth in morning, stop because dyspnea and palpitation. Cough may be whole day and sometimes accompanied with hemoptysis, sometimes. Edema cannot be released independently only after action of some medicines. Pain in right hypochondrium becomes continuous, not only after physical exercise entire day. And as a result, we see semi-sitting posture of the patient, obligatory 2-3 pillows, progressive cyanosis and visual dyspnea at rest because congestion of blood in lesser primary hypoxia plus secondary due to passage of blood through the tissue. Edema becomes more intensive and may be revealed any time of day. We can see swelling of jugular veins because blood difficulty come back from low and upper part of the body also. Final third stage. Together with the heart will be involved other organs. Complaints becomes more intensive because dyspnea appears not only due to problem with heart plus lung problem, because due to congestion of blood and lesser circulation will be sclerotic process into the lung, pneumosclerosis, alveoli losses elasticity plus filled with blood, dyspnea at rest. Patient cannot eat. Patient eats with very small portions. Patient cannot talk long time, only some minutes and must stop to breathe. Hemoptysis becomes more intensive. Edema doesn't respond on medicines because in pathological process involve kidney and liver. If liver will be protein mechanism of edema. Pain in right hypochondria becomes more intensive due to pathological response of liver and protective enlargement of the liver. First of all, due to overloading with blood, other due to protective response of the liver on damage of hepatocytes. On inspection, all symptoms becomes pronounced. We see orthopnea, patient cannot sleep, only sitting position. Progressive cyanosis and dyspnea. Edema spreads on whole body to anasarca and formation on curvizat face due to encephalopathy. liquid moves into the cavity and spread on whole body. Final third stage. And if you oriented in blood circulation, understand problems of the patient depending greater and lesser circulation, and principles classification heart failure on stages, you easily can explain any stage. Final stage, I said you, involved other organs and tissue. Let's see what problems will be with different organs. Lungs. Due to congestion of blood and leather circulation will be congestive bronchitis, which manifested with intensive continuous cough, harsh respiration, and dry and moist breath. Patient predilected to cardiogenic pneumosclerosis, alveolulosis, elasticity, plus blood with delayed into the leather circulation manifested with hemoptysis. Gastrointestinal tract and liver involved in pathological process. First of all, liver. Prolonged delayed blood into the liver finish with pathological growth of connective tissue into the liver cirrhosis. Will be congestive gastritis because low circulation restrict activity of the stomach glands. As a result, dyspeptic disorders. If patient feels discomfort after eating, he progressively loses appetite. Decreased activity of the liver and pancreas, non-adequate digestion of the food, will be impaired motor and absorptive function of the intestine. Patient feels some problem with defecation. And then we can see that patient progressively loses weight to cachexia due to progressive disordered digestive process, absorption, and metabolism. And if your patient complains of nausea, sometimes with vomiting, poor appetite, metabolic constipation, see attentively on the patient. And if you see that color of his skin is bluish, he difficulty breathe, he has specific forced posture, it's not true gastroenterological problems. It is secondary involvement of digestive system in pathological process due to primary heart problem and progressive metabolic disorders which finish with cardiac cachexia. Urinary system. Kidney, very sensitive to blood flow, and due to congestion of blood in greater circulation and problem with blood pressure, activity of the kidney decreases, restricted, and first of all it's manifested with decreased diuresis. If you remember last lecture we said you heart failure, oliguria with decreased daily diuresis. And will reveal pathological urinary syndrome in urinalysis. Will be proteinuria, as a result hyperstenuria. Urine will be rich with red blood cells and cylinders, which indicate that protein goes through the glomeruli. But it's not primary glomerulonephritis. It is congestive kidney due to progressive heart failure. Central nervous system. very sensitive to hypoxia, and first of all, patient loses vital activity, and then will be different mental problems and visible formation of Carvizat face. And if the primary patient becomes high irritable later, he progressively depressed, sleep all time, because no adequate vital activity which control this activity of central nervous system. Patient discharged from hospital with functional classes of the heart failure, which tightly correlated with the vital activity and stage of heart failure. Other words, in disease will show stage of heart failure and functional class. Stage of heart failure shows gravity affection of the heart. Functional class indicates vital activity of the patient. And you understand, fourth functional class, patient without restriction physical activity. He can live usually and do his usual work. Slightly restricted with active physical activity. No, cannot be professional sportsman. It is corresponding to first stage of heart failure. Second functional class, moderate restriction physical activity. It's corresponding second A stage, initial subcompensation. Third functional class, marked restriction. Patient cannot go to the work. He only can help himself. It is corresponding of second B stage. And fourth functional class, physical activity impossible and patient cannot help himself. He needed additional care. It is final third stage of heart failure. Next question on which I want to talk today, it is acute vascular insufficiency, which appears due to non-adequate blood supply of the tissue and organs due to discorrelation between circulated blood and volume of peripheral vessels. Again, attentively listen characteristic of vascular failure. Discorrelation between volume peripheral vessels and volume circulated blood. It shows that some vessels overfilled with blood, other vessels are empty. As a result, non-adequate blood circulation, which is characteristic for vascular insufficiency. It appears when the volume of the blood diminish due to bleeding, severe bleeding, when the patient loss of blood, or progressive dehydration because no blood plasma. You know that blood is formed from the cells and plasma. Other cause, when the vascular tone drops, some vessels dilated. We remember peripheral circulation is held with definite tone of peripheral vessels. Some vessels constricted, other delayed blood hold into the delayed blood vessels. It may be result of some infectious or toxic process, or maybe as non-adequate psychogenic reaction or response of hypercapnia to hold organism from toxic effect. Or it may be result of some nerve reflexes after severe trauma due to increased synthesis of adrenaline, some vessels significantly narrowed, and first of all, there are vessels of central nervous system, brain vessels. It may be due to irritation of serous membrane of the vessels. It may be result of the decreased heart stroke, left ventricle due to myocardial infarction, right ventricle due to pulmonary artery embolism. Other word, acute heart failure obligatory accompanied with acute vascular failure. Because these pathological processes go one near each other and combine in common circulatory failure. Pathogenic mechanism. Diminished vascular tone, I said you some vessels dilated, accompanied with redistribution of the blood in the body, blood hold in dilated vessels and restricted in constricted vessels. As a result, usually blood deposited into the vessels of abdominal organs. Vessels of the central nervous system of the brain becomes empty. As a result, if the blood delayed in peripheral vessels, it cannot adequately come back and cardiac output decreases. Volume of circulated blood also decreases. Stroke volume progressively decreases from one to other contraction. As a result, blood pressure, both arterial and venous, diminish. And we distinguish three main clinical forms of vascular failure: syncope, collapse, and shock. Clinically, will differentiate any form depending of time development, fastly or continually, and level of blood pressure. If you remember preceding slide, you show that pathogenic process finish with decreased blood pressure. Objective signs of vascular failure is decreased blood pressure. A dependent time appearance. We distinguished any clinical form. Let's see. Syncope. And pay your attention. Patient suddenly loses consciousness. It's general characteristic of syncope because on exam I'll obligatory ask you, what do you understand about syncope, collapse or shock? Syncope, sudden but transient loss of consciousness. When the patient falls, blood from lower extremities due to physical gravity low go to the brain, blood circulation restored, consciousness come back independently. Patient with syncope not needed, significant emergency aid. Why can it be? It may be result of being in a non-ventilated room, and I seen sometimes you feel some discomfort and some your friend loses consciousness due to severe fatigue. Usually it appears during exam because some night you not sleep, intensive intellectual work, intensification activity of central nervous system, using of a lot strong tea or coffee or smoking. As a result, will be problem with vessel tone and clinical manifestation of vascular failure. Overexcitation, physical or emotional, long starvation, any intoxication, and syncope is very characteristic for initial period of pregnancy when the mother's organism redistribute to prepare new process, because instead herself he must give some nutrition and control blood circulation and oxygenation as an organism fetal, and some women needed time for compensatory response, and fourth period may accompanied with predilection to syncope. What can you see? On examination, skin of the patient pale, and if you touch him, limbs will be cold because no adequate blood flow. Patient can cover with cold sweat and reaction vegetative nervous system. His pulse will be small, sometimes 30, and adequate objective signs: decreased arterial blood pressure. Not significantly, slightly decreased, but this process appears suddenly. We remember, any acute situation, organism cannot adequately respond to this, and maybe some problem, sometimes grave, and finish with death of patient. So, as patient with heavy chronic diseases can live long time. His vital activity decreases, but he lives. Some health patient, short time acute situation, and we lost him because no adequate protective response. No, if you see this patient, if you are near it, we cannot go out. You must help. What is needed? We must try lower extremity that blood more fast go to the brain. We can intensify ventilation, and we can spread the face and lips with cold water, or we can frict the temporal region, ear lobe of the ear, or fingers of upper extremities intensively, to intensify peripheral circulation. And when the consciousness of patient come back, we can give him hot, sweetie tea or coffee, because carbohydrate is assimilated glucose, sugar, needed to increase energy of the patient and stimulate peripheral circulation. Collapse. On contrary from syncope, appears slightly slowly. As a result, patient can complain. Patient feels this problem. If in syncope, sometimes patient don't understand. He stand, after sometimes he find himself on the ground floor because falls. Collapse have some times of development. Patient feels pronounced weakness, giddiness, some darkness in eyes, feels noise in the ear. Some patient can feel nausea. And if the patient oriented in himself, he immediately lie down or downward his head to intensify blood flow to the brain and can prevent loss of consciousness. If reaction of the patient is slow and non-adequate, this process also can be finished with loss of consciousness, but it's not obligatory for collapse, on contrary from syncope. Syncope cannot be without loss of consciousness. Collapse, possible. I'll separate because it's not obligatory. Patient can prevent if immediately lie down or downward his head. Collapse usually appears patient with intoxication, pneumonia, after some burning, and maybe after some severe diseases as acute pancreatitis, any intoxication. Other words, collapse is characteristic for the groups of the patient which sometimes was on strong bed regimen, and when will wide his regimen will explain the patient he gradually gets up, not suddenly as in completely health period. And shock. Blood pressure drops suddenly and significantly, sometimes to zero, which is characteristic for surgical and obstetric practice, but sometimes we can feel it in therapy. Usually patient with myocardial infarction because decreased heart stroke. It may be result of pathological nerve reflexes, patient with severe trauma or patient with severe pain, which is characteristic for biliary or renal colic. It may be result of acute therapeutic pathology such as acute pancreatitis because severe intoxication and pain. It may be a result of allergic reaction because anaphylactic shock are tightly connected and go together with vascular shock. It may be result of severe bleeding or dehydration. We said about it when we stopped on pathogenic mechanism formation of vascular failure. Clinically, we see process disturbance of consciousness which go through the stupor, torpor to coma, but on contrary from any chronic pathology, this process appears suddenly, short time, and sometimes doctor unable to see all periods of this disturbance, and he can see patient only final stage, unconsciousness. Skin of the patient is pale and cold as any vascular failure due to restricted peripheral blood flow, and will be change color of skin, maybe light bluish color, because if you remember, in shock blood pressure significantly drops. If no blood pressure, no adequate blood flow, progressive hypoxia. Objective sign is significant and short time decreased blood pressure. Sometimes it's undeterminable. As a result, pulse very difficultly palpated, and especially will palpate pulse on carotid artery. We'll remember, we'll use carotid artery in acute situation for examination of pulse. And to finish our discussion about circulatory insufficiency, I again want to stop on its basic characteristic. We distinguish three clinical types of vascular failure: syncope, collapse, and shock, which differentiated depending time appearance and level of blood pressure. Blood pressure decreases insignificantly, but suddenly patient loses consciousness. We are talking about syncope. Pressure decreases moderately, slightly slowly. We are talking about collapse. Pressure decreases suddenly and significantly. We are talking about shock. Time and level blood pressure is basic characteristic of any clinical types of the vascular failure. That's all today. Thank you for your attention. Goodbye and faithfulness.